how can women stay safe during that pregnancy if they have an older child at home who might be fighting the chickenpox?
Right. So fortunately, a lot of women did get the chickenpox when they were younger. So when that pregnant mom comes in and she's alarmed, my child has chickenpox, what should I do? The first thing you can actually do is test them for immunity. If they're fully aware, they remember, I was 4 years old, I had a horrible chickenpox outbreak.
Right.
They're aware. You can reassure them, but you could always test them for immunity, and that way you can really reassure them that they don't have any concerns for their unborn baby. Today, chickenpox, it's really not that much of a concern because either we had it as a child, we have a vaccine, so people today are all getting vaccinated when they're young, so that is great. In addition, fortunately, hopefully, a lot of people are going to come in for that pre-pregnancy visit.
Right.
Not
Yes.
everyone does that,
Right.
but if they do, that's a very important topic of discussion. Did you have the chickenpox? If they're unsure, they didn't, you can test them and you can vaccinate them before they're pregnant.
Okay, and that's a great question right there to follow up on that. You just mentioned coming in for a consult, if you will, a pre-pregnancy consult. Why don't you talk about why that is important and how during that visit you can address some of these fears, maybe find out more about the mom's history, and how that's just going to make for a better pregnancy overall.
Oh, absolutely. Not everyone does that, but if they do, it is a great opportunity to discuss being up to date on your vaccination. So varicella, chickenpox is one of the important ones that you can absolutely discuss at that time. And if they're unsure, test them for their immunity. If they end up that they were not immune for varicella, that's a great opportunity to vaccinate them, in addition to going over a tremendous amount of information at that pre-pregnancy visit to get them ready for that pregnancy.